Thank you so much. Welcome to Assah Media Podcast, and I'm so grateful that you're watching this video. Today, we are discussing about STIs, that is sexual transmitted infections, and joining me on the program is a professional health personnel, that is Mr. Adrawa Stephen. You most welcome.
Thank you, Assah. My name is Assah Stephen, a clinical officer working with the Moyo District Local Government.
Thank you so much for joining me. I want you to start by maybe giving for us a brief highlight examples of STIs so that someone who doesn't know diseases under STIs will get to know.
Okay.
Yeah.
Thank you so much once again. As you said, today we shall discuss about the sexually transmitted infections. Yeah, when we talk of the sexually transmitted infections, it is just a broad term. It's just a collection of, let me say, disorders. Yeah, in the medical terms, we call it syndromes. It is just a collection of signs and symptoms, actually. So when we talk of the common STIs, these are the following. The most common ones we have the chlamydia, that is one. Then two is we have gonorrhea, that is the second one. Then thirdly we have HIV, is also one of the STI. Then also we have syphilis, which is one of the STIs. And we also have the herpes virus, that is also one of the STIs. Then also the one which is most common is we have also the genital warts, though they are not so much, but we also have the genital warts which are there. We have hepatitis B, which is also one of the STIs. I think basically those are the most common ones.
Yeah. Now you have mentioned so many. Like, what puts someone at risk of getting those diseases you mentioned?
Okay, risks for acquiring these STIs. One is when you have unprotected sex with someone. Anyone you don't know the status, that one puts you at a high risk. And also when you have multiple sexual partners,
more than one,
that one also puts you at a very high risk. And also when you have a new or casual sexual partner.
Those ones belong, like they come and go.
Yeah,
they are not
casual. Yeah, they come and go. That one also puts you at a high risk of acquiring these STIs. And also another risk is sex work. Yeah, those who are doing sex work, like the prostitutes, are also at high risk of acquiring that. Age is also one of them, more especially the young people. When we talk of young people, these are people from age 10 to 24. Yeah, that one is also because they are sexually active, so they are at high risk of acquiring these STIs. Also, substance use, like these other drugs or alcohol. Yeah, when you're intoxicated, you are at high risk. You don't fear, and you go for.
You just do it and you regret the following day.
Yeah.
Now, like, how can one know that he or she is affected with these infections?
Okay, these STIs, the most common sign we experience is one. Okay, it affects both male and female. Yeah. So in both sexes, you will find that one may feel okay. You see from your private part. Let me say either the penis or the vagina, there will be discharge, pus discharge. There will be pus discharge, and sometimes you may, when you urinate, you feel pain in urination. So those are the common two, and there are also other STIs which affect the genital. It forms sores or small wounds around the perineum, the private parts, let me say. Yeah. Those are the most common, the three most common signs.
Now, are they all? Do they all have signs, or some of them are asymptomatic?
Okay, not okay. There are two. One, there are some. Okay, most of them they have signs, and then there are some which are symptomatic. There is no sign. You'll find when it is, in the later stage. Yeah. So basically, those are the signs and symptoms of STIs.
Now, what? Okay, how are these STIs typically treated?
Okay, the treatment part, it is both preventive and there's also the medication which you give. When you come to the preventive part, of course, we begin with prevention. We say prevention is better than cure, of course.
Yeah.
So when we the preventive part, one is we need to educate these people. Let me say the general population. We create awareness about the causes, the signs, the symptoms of these STIs. So once when you are aware, you know how to prevent the infection. That is one. That is giving education to the people. That is one of the preventive ways. Another preventive way is when you take. Okay, it is like practicing safe sex. By safe sex, I mean you either use, when you have sex, you either use condom, you protect it using condom, or when you're married, you have to be faithful to your partner. Yeah, that is practicing safe sex. Then also another preventive way is seeking for treatment early. Yes. When you seek for treatment early and you are treated early, you also get, you prevent others from acquiring these infections.
That one calls for regular testing.
Yes.
Maybe after some few months, you go test yourself.
Yeah, regular testing. Yeah, that one is one way of early detection. And once also, when you have the infection, like you're married or you have a partner, you have to also notify the partner and also the partner so that the partner is well treated. So that is one of the preventive ways. And now when you come to now the definite treatment, we have antibiotics which are there, and also the antivirals which are there, because these STIs, they are not only caused by bacteria, they are mixed infection. They are bacterial infection, there are others which are viral, and others which are fungal. So mixed infection. Also, we can prevent by vaccination, more especially hepatitis B and this HPV, human papilloma virus. Yeah. So those are the ways how we can prevent or treat these STIs.
me, I normally hear that people say STIs mostly match among the youth. Now, do you have clarification, maybe a statistic that talks about the HIV prevalence among the young people?
Um, okay, when you take the whole country, that is Uganda, one study recently done shows that the prevalence is really high among the young people. One study shows that when a specific population of young people were taken, so around 33.2% of the young people have acquired this new infection. So when you come down to now our district, that is Moyo district local government, I took a statistics from 2000, yeah, up to September this year, 2025. The general population, we had about 2,591 new cases that are being recorded and registered in the system. But that is the general population. Of course, when we are generating our data, we take age groups. Yeah, that 2,500 is for the all age group. Yeah, from 0 up to 50 plus. So, for us, we categorize them like if we take the young people, that is from age 10 to 24. Mostly in our district, the adolescent, that is age 10 to 19, since 2000, data we have registered around 391 cases.
So high.
Yeah, it's really high. And when you take those from 20 plus, they're about 2,100 and something cases. So that 20 plus also includes the young people. So it's really high.
Yeah.
Yes.
So now,
and actually, those are the ones which has come to the facilities.
Yeah, sure.
Yeah, there are others which have gone to other private clinics, which are not, which are not registered.
Now, so according to you, how can we encourage this young generation to get tested and treated in case they are infected? How can we engage them?
Okay. One strategy which we have been using is we normally do sensitizations in the community, we do outreaches. We go with the music. Yeah, you know, the youth of this day,
Yeah,
they are
sure.
more attracted with the music. So the music, and you find they'll come. We talk, we give the health education. From there, we encourage them to go for the testing. Of course, the music is here, then the health team who are testing, they just come when the music is there. We use actually all, even at the health facility, in our daily session, we give health education. Yeah, to them, and we keep on encouraging. And also in the facilities, we have adolescent-friendly services. Normally, there are these young people from age 10 to 24. We normally have special clinic days for them. We call them, and they are this common playing. We have cards, ludos, which are there. Also, educative videos. We just attract them, and we talk to them. We test them. That is how we bring them. Yes.
From my own observations, I normally see schoolgirls most times they complain so much about, okay, let me say, itching of their private parts. That's now when you talk about the vagina. Most times, now, I don't know how to conclude it. So I conclude that maybe where, like in schools, in boarding schools, where they take their bath from, is it like when you take your bath in a dirty place, can it also expose you to such kind of infections?
Okay. Yeah. When you talk of those itches, mostly those itching of the vagina, they are caused by this fungal, which most common one is the candida. We have the candida, which is a fungal, and mostly it comes when there's the hygiene is not okay. Yeah. So those candida, one can get it from using the towels which are there, which and also the basins, the buckets they are using. Those sanitary items, let me say generally. When one is infected with this candida, and also the next person takes and use those sanitary items, one can get the infection. Yeah, it's most common in schools. You find that's why in the boarding sections they encourage each person to go with those buckets and that, so that they don't sell. Yeah, mostly those itches are brought about by those unhygienic yeah, situations.
Now,
Okay.
I just want us to look at the fear people develop in themselves. Like sometimes I may have those signs which you talked of earlier, like maybe painful urination, the itching, but I may fear to go for treatment because maybe my friends or some other people may laugh at me. How can we help such kind of?
When we talk of the fear in people coming for to seek health attention, normally we address that one like we say it is a stigma. So when you take stigma, in order for people not to fear or have that stigma, we need to intensify uh, health education. We give more education and awareness about these STIs. We talk of the prevalence, how it is transmitted, and when you are maybe infected, it can be treated. So that one will feel that, since I have this infection, so it can be treated, I think I have to go treatment. So education and awareness is more important in taking away this fear. Another one is like when someone comes to you, like to me as a health professional, you have come with those signs and symptoms. When you are really giving out your complaint, I should not judge you. Like maybe let me say you say when I go to urinate it pains, so I say but why, so this kind of thing
Can scare someone.
can scare someone. So I should not judge. Yeah, should be non-judgmental. That is the second one. Then another one is when you come I should give a supportive kind of environment. Like when you come, I should show sympathy. Yes. to encourage you not to fear. So that one is really, really very important in averting these fears in the people. So those are the three ways of getting fear out of people. Another one is when you make like testing for this STIs more frequent, someone will get used. And when you get used, you don't get that fear of testing. So those are the ways I think we can avert these fears in the young
Okay,
people.
according to your own observations on the ground, do you see parents and guardians working hard to make sure that their siblings are not infected with these STIs, according to your own observation on the ground?
Um, when you take currently, parents are really trying their best, but these young people nowadays they have devised means of really practicing this behaviors. So parents are really trying their best, but some parents also end up like giving up now that this child has really overpowered me. It's really there, but otherwise parents are really trying their best.
Now there's this funny part I normally hear people talk about when they go to test. Someone was saying that he went to test for HIV. Then after testing, they have started asking him, now if we get you positive, what will you do? And at the end, he's not positive, and he really got scared. Now most people are talking of that. Now, to me, is it not really like if you find someone is negative, say, you're negative, then you should go and do this? So is that part of it? Because most people say that these you people in the hospital that you're giving for us fear before even giving for us our results. What do you have to say about that?
Okay, in testing, um, in testing for either this STIs, let me say, most commonly people go to test for HIV. Yeah, but in testing, there is counseling, and that counseling is done before. That is the pre-test counseling. We talk everything about the infection and also your expectation or the outcome of the results. Yeah, when you find positive, what do you do? Because we want to find out how you feel when you're positive. So we do that pre-test counseling. So also as we are testing, we also continue with the counseling. Then after the results, we also do the post-test counseling. So once when the pre-test counseling is really well done, we find declaring the result will be easy. But once the pre-test counseling is not properly done, so the results, I mean the post-test counseling, after the results are out, will be so terrible. Even releasing the result will be. So it all depends on the counseling. Yes, when you prepare this person's mind very well, the person will not panic. So, so people should not get worried of receiving the results because there are two things, either positive or negative. Yeah. So the long time we take for declaring that result now depends on the counseling session. Yeah.
Now, like you talked much about sensitization, like maybe in our communities, and also the health education you people give to people, to patients when they come to the health center. So apart from all those efforts, is there a specific government program that caters or that emphasizes on seeing how these STIs are prevented among the youth?
Yes, the government have programs, and these programs they are normally brought down to the facilities.
Okay.
So it's now upon the health facilities to implement this program, like I have talked of the adolescent friendly services, which we provide at these facilities from level 3, that is health center 3, and above. So these health education or sensitization programs are there packaged for these young people in the in that that package it is there. So also sensitizations also we do carry, like I talked of, the outages. We go to the community and we give this outreach. Those are all the government program which are now brought down to the health facilities. Yes, and though they also partners which are there, the health partners we talk of. Like here we have agri center. We used to have Ford, which are they with these young youths, so the young people. So those programs are there. It is a government program, but implemented by the partners. So they are there. Government programs are there.
How often should one test for these STIs?
Okay, the STIs, we have standards for testing for this. Okay, the duration, let me say, it is there for general public, like when we are testing for HIV. Previously, for HIV, like we test the routine test. We do it like every after 3 months. You say when today maybe you come for testing for HIV, test negative, they say you come after 3 months. Then you come again, they test for HIV. So, but now the government has brought, they are actually for different, let me say, categories of people. Yeah, there are those who are at very high risk. Those ones we do test them often, like the 3 months, 6 months, 9 months. It's also there. Yes. So there are others which are routine, like when you come for those services in the health center, they are like antenatal. We do routine checkups.
Those are the ones at high risk?
Yes, high risk, the pregnant people, the young people. Those are the very high risk. Those sex workers. Yes, minimum 3 months.
Okay.
Yes.
So do this test also goes up to the health center tools, or you just go and test from a general hospital?
Okay, the tests now we have tests up to health center 2. Yeah, health center 2 we also do HIV testing at the health center 2, but the health center 1 is run by the village health teams. So there currently they are not doing those tests for this STI like HIV. It starts from health center 2 and it goes up. Health center 2, 3, 4, hospital and above. Yes. Also, those tests, like the ones in the health center 2, they are limited. Not when you compare to health center 3 and health center 3 to health center 4. So there are levels of testing for this.
Now, before we wrap it up, I would like you to highlight the key points from our discussion, so that we remind someone who is watching this of what we discussed here, maybe the examples of the STIs we talked of, how they are spread, the signs, and we conclude it from here.
Okay. We began with the STIs. We said STIs, these sexually transmitted infections. As the sounds, it is mostly transmitted when we have sexual intercourse with someone who is infected. And once you are infected, uh, you feel those signs like there is pain on urination, and you'll find that there will be also past discharge from either the penis or let me say the urethra or the vagina. There will be past discharge when you have this STI. When you get the STI, you need to seek treatment early. We encourage prevention rather than the cure. So we talk of the preventive measures like you need to have safe sex practices like using condom if you feel like having sex with someone maybe you don't know. Also, once when you are married, you need to be faithful to that one partner. Early seeking of treatment. Once you feel these signs are there, you need to come to the health facility. You are tested, and once you get, we get the STI is there, we treat you. Yes. So we also encourage vaccination, especially for this hepatitis B and the HPV, human papilloma virus, which is common. We vaccinate these 10-year-old girls, yeah, to protect them against the human papilloma virus. So, and once now you are married and you have maybe you, the male, is infected, you need to tell your partner that I have this, I think, so that you are both treated. And finally, when the infection is there, you come to the facility. I will give you comprehensive treatment for these infections. So that is basically what I can tell the viewers out there. Let's come and have regular checkups. Not
It is
only
free.
for
It's
HIV
just free.
and
Yeah.
those other non-communicable diseases like diabetes, hypertension, which are common nowadays. So that you get to know your status. Yes, that is basically what I can say at this time.
So to conclude it, do you have any health tip apart away from the STIs? Maybe someone can pick it from you. Any health tip for someone watching this video?
Okay. Couple with now what is going on, and the type of food we eat, we don't exercise. So I'm encouraging us to exercise more to avoid this non-communicable disease which I've talked of. Talk of diabetes,
Yeah.
yes, and hypertension. Nowadays is common, which leads to also stroke and other various diseases. So I'm encouraging us to exercise and go for testing so that we avoid these non-communicable diseases.
Oh, thank you so much, Mr. Adrawa Stephen, for coming to join me on this greater program. We have come to the end of this program. It has been me, Vital Assah, and that is Mr. Adrawa Stephen, a clinical officer. Thank you so much. We'll link up next time.